and you're having a difficult time getting your child to say his or her first words, listen up. Speech pathology and occupational therapy can help your children succeed in academic performance and social participation. Amy Bedsole is a speech language pathologist at Springhill Medical, and Katie Buford is an occupational therapist at Springhill. Thank you, ladies, for being here and joining us again.
Thank you.
Okay, so first of all, we're going to start with Amy. Amy, how can a language speech therapist help children who are having a hard time communicating?
Well, I think that the communication process and those early initiation of the vocabulary can be extremely frustrating for parents and both for children. And the reason why is because parents are focusing primarily on labeling instead of requesting. So in other words, when parents may be at reading time or, opening up a book at night and saying, what's this, say apple, say apple. Well, the child's not motivated to say apple, so they don't say it, and then they're both frustrated. So instead, what they should do is focus more on requesting. So get something that the child is really motivated by. That's a key word, motivated. So it can be maybe their juice, or it can be an activity, maybe sliding down a slide or something like that, and get them to try and attempt the word and make their best, what we call approximation, to follow through or request the object or, activity. And then once they do, you immediately reinforce it with sliding them down the slide or with giving them their juice, and then that starts the communication process because the child makes the connection of, hey, I say this and I'm going to get this. So once they make that connection, which will not happen with labeling, so very important to do the requesting. So once they make that connection, the vocabulary develops from there.
At what point would a parent say, okay, I need to take my child to see a speech and language pathologist?
Yeah, that's a common question, and if you look at the developmental milestones between 12 and 24 months, according to the developmental speech and language milestones, a child should be saying more words every single month. So parents get, really hung up on the fact, well, my child's not putting 2 words together, they're only saying mommy and daddy, they have a 10-word vocabulary, and if your child has a 10-word vocabulary and they're 24 months old, that's usually the age where I would say, hey, 24 months, you're not seeing a steady increase in the vocabulary. Let's go ahead and contact the pediatrician, let them know your concerns, get over to a speech therapist, and start working on on the therapy, and then also, start working at home.
And at some point, you may call in an occupational therapist like Katie, and it kind of works hand in hand. Katie may call in a speech pathologist like Amy. Who makes that first referral and says you need to go see a speech pathologist or an occupational therapist?
Usually it's the parents' call. They can identify whether they feel like there's a concern, and a speech therapist can come to me and say, I think we have some triggers here that we might need to address, and the same goes for the OT to the speech. And then anybody involved in the child's life, the teacher or the doctor, might identify and bring some concerns to the parent, and then the parent will get a doctor's referral, and then the doctor's referral will come to us, and then we will do our job from there.
Sounds good. Okay, now, Katie, last time you were on the show, we talked about the close collaboration between disciplines to provide the best care possible. So please reiterate what you talked about last time, and also describe who else would be in the treatment planning, the carrying over process.
Right. Just like I said, with all the people that are involved in the child's life could identify the concerns, we also recognize that the family and the caregivers play a vital role in the child's well-being. So we incorporate the family and or caregivers into the treatment planning process. We also include the child's interest in the treatment and in the goals that we set for the child. And then we also know that the child's occupation is their school career. So we get the teachers involved to see how they're doing in the school, see if they need some help, extra help, and those are the types of things that an occupational therapist will work on, the things at home that might be a little more challenging, and the things at school that might be a little more challenging, along with social skills and behavior and stuff like that.
Okay, wonderful. Now, as Katie and Amy said, it starts at home, so if you see any warning signs and you think your child may need to see an occupational therapist or a speech and language pathologist, you can find out more information on our website. Just go to the Studio 10 tab on fox10tv.com. Thank you, ladies, once again for being here.